Good morning. My name is Carly Viola, and today we're going to be talking about emotional intelligence in the ambulatory oncology setting. We're going to be talking about quality improvement measures, risks and benefits of emotional intelligence, and how leadership can help formulate better teams and more effective processes. So let's go ahead and get started. Here at the Massey Cancer Center, we have the goal of becoming the foremost comprehensive cancer center in Virginia. However, in order to reach these very high achieving goals, we must first admit our faults. And communication is a huge area of growth that every member of this team has to improve on. The reality is that communication amongst the team members providing care for patients can be broken, fragmented, and incomplete. And the detrimental results of that incomplete communication are far-reaching. The patient care is compromised, leading to an array of potential problems, including delays in diagnosis, delays in treatment, and even the wrong treatment. In addition to these delays and errors, financial, economic, and behavioral damages to the members of the multidisciplinary healthcare team can suffer as well. Financially, we know that medical errors cost millions of dollars in the United States hospitals due to a decrease in reimbursement from insurance companies and the federal government. A big impact that we can change as a team is to improve our communication and decrease those areas of preventable breakdowns in practice. So our current state is here on the left, not great communication, people aren't being heard well, and our desired state is here on the right, where we have two people communicating with a key and a lock, meaning that they understand each other completely. A very common used quality improvement process model here in the Massey Cancer Center is the lean process. We start in the lean process by patient surveys, dictating what satisfies the patient most. We take that information, we analyze it, and then we build a multidisciplinary team to set priorities and develop systematic improvements. Improvements can include things such as valuable time, resources to the team, and eliminating wasteful tasks and meaningless duties. Really streamlining value added versus value not added is the goal for the lean process. And when it comes to emotional intelligence, patient satisfaction data can reveal that patients perceive there to be poor communication between the doctors and the nurses, really excessive wait times for their appointments here. And we can use that information to help the multidisciplinary team show how emotional intelligence training will improve communication and develop a standardized guideline in patient scheduling. There are a number of stakeholders and motivators that would be invested in this. First will be those who are leaders and managers and directors over the direct care roles, such as nursing managers and medical directors. These administrators directly oversee the teams that care for patients and are strongly devoted to the quality improvement process that improve communication amongst those workers. Research is vast on the benefits of emotional intelligence and its application in the healthcare setting. In fact, one comprehensive study shows the positive correlation between emotional intelligence training and the attributes that make healthcare workers strong stewards of collaborative team members, such as using altruism, courtesy, conscientiousness, and civic virtue. External to the health system are the academic institutions that contribute to the growing community of future doctors, nurses, and pharmacists. Contemporary schools of medicine, nursing, and pharmacy collaborate together to include interprofessional education components to their curriculums. In addition to problem solving as a team and communication techniques, investing time and resources into teaching our future healthcare workers the theory and practice of emotional intelligence is very much so needed. The benefits of QI include transparency, closed-loop communication, and a safe work environment. Quality in healthcare improvement measures must have clear benefits and acceptable risks. Thankfully, an emotional intelligence training provides the opportunity of many benefits and the chance of any detrimental outcomes to be very low. Evolving the culture in an ambulatory unit to function with greater efficiency, closed-loop communication, and build a work environment that is safe and transparent are all goals of an emotionally intelligent staff. There, of course, can be risks. Once you understand how many different ways emotional intelligence can benefit an institution, it becomes clear to see the risks of not implementing such a simple and evidence-based practice quality improvement plan. The present and future of healthcare dictates that we as healthcare professionals must stop working in individual silos and shift our attitudes to team functioning, efficiency, and collaboration. Long gone are these days of that's someone else's job, that's someone else's area, or someone else will take care of it. Because as an outpatient cancer center, we are accountable to be respectful and communicate and always keep the patient at the center of all of our actions. Training for emotional intelligence can be interpreted by some as an invasion to their privacy. Since working in small groups, role-playing, and discussions about your own personal weaknesses are all aspects to the theoretical framework of emotional intelligence. Therefore, educators on this topic must find ways to master the objectives of learning without invading the privacy of the learners themselves. In terms of ethical considerations, learners must understand that it is possible to conduct oneself with refined emotional intelligence but still be unethical. These two are not inclusive of one another. For example, individuals who have ill intentions are pervasive in every area of business, and healthcare is no exception to that. People can use emotional intelligence to establish trust and empathize with others, only to turn around and lie and cheat to get what he or she wants. In fact, it may be easier for someone who's emotionally intelligent because they know how to read people. And that's why we need to understand that things that are always emotionally intelligent are not ethical. Finally, we want to talk about how nursing leadership can impact changes and foster change in our staff members. The foundation of transformational leadership is building relationships and establishing trust. Once trust is established, leaders can understand the strengths of each individual team member and help center those strengths to be organized within the team in the most effective means possible. There's a reciprocal relationship with transformational leadership. Nurses that respond to transformational leaders end up becoming transformational leaders later in their future. That's all for today. Our references to discuss, and I look forward to discussing this more in the future.